The U.S. Department of Agriculture (USDA) reports that the average American ate almost 20% more calories in the year 2000 than they did in 1983, thanks in part to a boom in meat consumption. Today, each American puts away an average of 195 pounds of meat every year, compared to just 138 pounds in the 1950s. Consumption of added fats also shot up by around two-thirds over the same period, and grain consumption rose 45% since 1970. Yes, folks, today we are discussing why we as a nation, we Americans, are obese, the consequences, the reasons, and finally the solution to the problem. This is Rick here from healthybodiesandminds.com. Hope you all are staying healthy and sane, and let's jump into today's video after the short intro. Research published by the World Health Organization found that a rise in fast food sales correlated to a rise in body mass index, and Americans are notorious for their fast food consumption. Such food makes up about 11% of the average American diet. Another study demonstrates the full effect of added sugars from soda and energy drinks are wreaking havoc on American waistlines. So it is not just how much we eat, but what we eat. So, what are the consequences? Number 1, declining health. According to the American Heart Association, 1 in 3 US children and teens are now considered overweight and obese. The long-term consequences of this childhood obesity epidemic are devastating. The AHA warns that today's children may be the first generation in the US history to lead shorter and less healthy lives than their parents. Obesity has become a serious health problem in the United States. Nearly 35% of Americans have obesity. Obesity is not just a problem of girth control. It is now considered a chronic disease by the American Medical Association, the American Association of Clinical Endocrinologists, the American College of Endocrinology, the Endocrine Society, the Obesity Society, the American Society of Bariatric Physicians, and the National Institute of Health, NIH. It is, in fact, a national epidemic, according to the Centers for Disease Control and Prevention, CDC. And it is not just a weight problem, it can have serious effects on a person's physical, metabolic, and physiological health. Obesity is linked to rising US rates of dozens of chronic illnesses and conditions, including diabetes, heart disease, and cancer. Let's talk about these problems in a little bit more detail. Diabetes. An imbalanced diet and a lack of exercise can cause insulin resistance and full-fledged type 2 diabetes. Like obesity, the rate of diabetes has risen nearly 70% since 1995. Cardiovascular disease. This disease is the leading cause of death in the United States, and obesity is the leading risk factor. In 2007, 1/4 of all US deaths were from heart disease. Can you imagine that? Yes, 1/4 of all US deaths. That's quite a big number. Next, cancer. A close second behind heart disease as the leading cause of death in America, obesity contributes to many types of cancer. In fact, weight gain and obesity are considered a contributing factor in 20% of new cancer diagnoses. Next is depression. Numerous studies have suggested a link between depression, obesity, and weight gain, especially among children. Reproduction. Research indicates that obesity reduces fertility rates and increases the chance of miscarriage in pregnant women. Respiratory disease. Sleep apnea and obesity hypoventilation syndrome are very common in overweight individuals, as is asthma. Cognitive health. Neurologists have identified a link between obesity and cognitive decline, including memory loss and thinking skills. Musculoskeletal disorders. Obesity is a leading cause of arthritic pain, injuries, and atrophy in muscles and joints, often in the knee, ankle, foot, and shoulder. Let's talk about the costs. Now, this actually costs more than financial. If the incidence of obesity continues to climb, combined healthcare costs associated with treating obesity-related diseases could rise by $48 billion to $68 billion per year by 2030. The loss in productivity could total between $390 billion and $580 billion per year. The cost is more than just financial, however. Obesity can lead to early mortality and increased susceptibility to other diseases and can have an incalculable impact on quality of life as well as on the family. So, what can we do as a nation? In the wake of the obesity epidemic, government and local organizations are mobilizing to reverse the trend. While the onus is on every individual to regulate their weight, there are also initiatives to champion at the community level. Health education. The most critical initiatives in the battle against obesity are aimed at combating obesity in kids and teens. The most notable of these is the federal Let's Move program. Launched in 2010 by Michelle Obama, the project aims to cut obesity rates in kids primarily through the following initiatives. Number 1, physical education. Despite the growing obesity crisis, many schools are not giving kids the exercise they need. The CDC reported that in 2012, half of the nation's high school students take no physical education course. The most common culprit behind this lack of exercise is budget cuts, as reported in the New York Times the same year. The Let's Move initiative, on the other hand, says kids should have at least 60 minutes of physical activity every day. Next is recess. With more and more attention given to standardized test results, treating them as the ultimate metric of a school's success, recess times are being cut short across the country. This, in turn, impacts a child's ability to exercise as much as is recommended. Next is sports programs. With school budgets being slashed over recent years, even sports are on the chopping block. In many cases, schools are charging parents additional fees for their children to participate in sports teams. This policy, called pay to play, makes it harder for lower income kids, already disproportionately affected by obesity, to participate in athletics. According to one study from the University of Michigan, 61% of middle school and high school athletes pay fees out of pocket to play. That's really very bad. Next is healthy meals. A major pillar of the federal Let's Move initiative is getting healthier food in American schools. So in 2012, the US Department of Agriculture released new rules to boost the nutritional quality of hot lunch and school breakfasts. Many school districts also have moved to ban junk food and sugary sodas. Let's now talk about healthcare. The Harvard School of Public Health advocates using healthcare providers as a counterface to the growing obesity and weight gain trends. Doctors can provide useful information and encouragement, and health insurance companies can incentivize enrollees to stay in shape through covering weight loss and wellness programs. It is no surprise that the Affordable Care Act is now requiring insurers to take on obesity. Food and exercise. Finally, it all boils down to food and exercise. Unfortunately, in America today, we are surrounded by junk food, which is usually extremely high in added sugars, and we are not even talking about sodium. Too much of sodium is very bad for your health. And even worse, this food is often easier to prepare and more accessible than healthy options like fruits and vegetables. To meet this challenge, Harvard University School of Public Health recommends restricting easy access to junk food, making healthy options more available through subsidies, increasing labeling standards, and taxing sugary drinks. According to a study conducted by Kaiser Permanente, 1/3 of Americans say they don't even walk 10 minutes a day during the week, and another third don't even walk enough to meet the minimum threshold for physical activity set by the CDC. As a result, Harvard School of Public Health recommends communities pursue living environments that encourage walking and biking rather than car dependence. So yes, exercise isn't a choice, it's mandatory. And finally, it's also important to understand that obesity is 70% food and 30% exercise. So it doesn't really matter how much time you spend at the gym. If you can't say no to that cheeseburger, it's just not going to happen. So take an oath today that you are going to walk at least for a few minutes a day. You're going to avoid all those sugary drinks, and you are going to give your body a good amount of rest so it can rebuild itself up and prepare itself for the next day. This is Rick here signing off for now, and I hope to catch a healthier you in my next video. Please don't forget to like, comment, share, and subscribe to the channel.